and you'll let Dr. Shariar in when he joins in.
Okay, Mark, we're live.
Great, thank you. All right, good morning. Thank you, Rajkumar.
Dr. Shariar has also joined in. Perfect.
Perfect.
We'll just wait for a minute more, Mark. People are joining in. For everybody who joined and waiting, thank you for coming in. We'll be starting the stream in a few minutes more, waiting for people to join. The team from CyberPatient is here with us. What is the time in the place where you are, Canada, and rest of you?
Yes, 7 a.m. here in Vancouver.
Shariar,
It's a beautiful sunny day today.
So the entire team is from Vancouver, Mark?
Yes, we're all based in Vancouver. I believe Dr. Shariar, he's in Iran at the moment, attending to some family items, but good morning, Dr. Shariar. How are you?
Good morning, Mark and Nikki.
Good morning.
And Mr. Kumar.
Yes, morning. Okay, so we'll start, Mark. There are some 20 participants and people will keep trickling in as the webinar goes on. So good evening, everyone. This is good evening in India. So good evening, everyone, for joining and at this ungodly hour, 7:30 p.m. But thank you all for coming in. We have a very interesting webinar coming up in collaboration with CyberPatient Canada. So CyberPatient Canada is an organization which has been using virtual simulation to work towards competency-based medical education. And that is what they'll be talking about today. The platform is very intuitive. I've had the pleasure of using it, and it's going to change the face of medical education forever, especially in Indian context when we're talking about CBME, vertical integration, and also in the terms of next exam for residency entrance. So without much further ado, I'll hand over the platform to our audience here, to our guests here. We have Mark with us, who's the Director of Business Development. We have Nikki from Customer Satisfaction and Dr. Sharia, the medical lead of CyberPatient. We were supposed to have Dr. Karim Kayumi with us, but he's been held up in an emergency. So that team will be
Thank you so much, Dr. Rajkumar. Appreciate it.
Yeah.
Good afternoon, ladies and gentlemen. Good evening. My name is Mark Ritchie. I head the business development here at Vancouver, Canada. Today we were to have Dr. Karim Kayumi, our CEO and founder of CyberPatient. Unfortunately, due to a personal emergency, he is unable to make it today. However, he has promised that he will be hosting a lecture at a later date for you, focused on competency-based education. So in today's session, we are going to give you a very in-depth overview and an introduction of CyberPatient. Following that introduction and the platform walkthrough, we'll talk about our summer school program and also how you can get involved with CyberPatient. And I understand in India that competency-based education is taking center stage. And CyberPatient, we're here to partner with you to support your institutions. And we look forward to helping to make an impact on the overall medical education within India. So I have with my team with me, I have Nikki. She's a business student and heads our customer support. And then we also have Dr. Shariar, who is our medical lead, and he'll be here to answer any questions that might arise. So without further ado, I will jump into a presentation just of CyberPatient, and then we'll jump into the platform demo. Dr. Rajkumar, if I may kindly ask, I need permission to share my screen, I believe.
Oh, one moment, Mark. I'm adding you as a host.
Thank you.
Yes. You should be able to share now. Try again.
Great, thank you. There we go. Share screen, perfect. And you should be able to see my screen here.
Yes, we can, Mark. Looks good. Yeah.
That's great. Appreciate that. All right. So, CyberPatient, we are headquartered in Vancouver, Canada. As mentioned, it's 7 a.m. here. It's a beautiful day, and I'm looking forward to soon when we can be together actually within India. I understand that's your evening there, so we greatly appreciate the time that you've taken to join us today. So we like to start off by saying, bridging the gap. CyberPatient, we see that there is a distance between the theory and the practice of medicine. And we see that CyberPatient and simulation tools like CyberPatient, we really work towards closing that gap. And let's talk about what the problem is that we see in medical education and how we can help to support and to address it. One of the major challenges that we do see is that real patients are used for medical education. When we do have students who are just novice, they're learning to practice, there is, of course, an increased risk to the patient, ultimately resulting with an increased cost to the healthcare system. So the current approach, of course, we have standardized patients and simulated mannequins. These are critical and important tools, however, they are very costly. And there are ways that we can better prepare our students for those standardized patients and simulated experience so that they can be much more effective and have higher outcomes. And our research also does show that, and we'll talk about that towards the end of this presentation deck. I found this statistic here from Yale. Many students, nearly 92%, witnessed at least one error during their clerkships, resulting in harm to the patient. This was quite worrisome, and I believe this is why we do have simulation, so that we can make sure, excuse me, so we can make sure that the treatment to the patients is accurate and resulting in less harm, making it safer. So this is Dr. Karim Kayumi. He's our CEO and founder of CyberPatient. In this note here, he says, CyberPatient is not designed to replace theoretical knowledge, physical clinical skills, or standardized patient programs. It's rather a supportive tool to help students go through the first 3 stages of the 4 stages of learning, which is introduction, coaching, and fine-tuning. And of course, the 4th being mastery. It is designed to enhance compiled thinking and recall recognition while using visual, tactile, and written memory in a safe virtual environment. Therefore, it's at the discretion of the university and the faculty to use the platform in a way that enhances their curricular and extracurricular activities. As many of you may know, Dr. Kayumi, he is a professor at the University of British Columbia here in Vancouver, BC. He's created these fantastic expert series lectures, which I'll share out with the group following, but it can be found on cyberpatient.ca on our learning resources. And we'll share this out as well, so you can also take advantage of this additional content, talking about theories behind education, competency-based education, curriculum development, and also gamification. So just a little bit about Dr. Kayumi. He founded the UBC Center of Excellence, which is the simulation center at the University of British Columbia. He was also the first chair of the Technology-Enabled Learning for Vancouver Coastal Health, and also regional director of the College of Physicians and Surgeons in Canada. Very extensive teaching experiences, has won many awards. And as far as educational professionals and medical professionals, I have to say he is very, very passionate about CyberPatient, and also making sure that we are able to help to equalize and support the development and the pioneering, if you will, of medical education. So now let's talk about CyberPatient as a platform. What does it consist of? The best way that I can say that CyberPatient is, it's a safe and diverse virtual training hospital on available demand 24/7 for your students. It currently has 130 virtual patients, both inpatient and outpatient cases and surgery cases. It is focused on competency-based education, built upon the gold standards of medical education. We'll talk about that shortly. Covers the full continuum of care. So rather than focusing on a specific point of care, this will take the students from start to finish of care for their virtual patients. Inside of the platform, there are thousands of diagnostic and animated assets, which are used for the physical examination, the treatment, procedures, the surgery, and the diagnosis of those patients. And of course, in the back end of the platform, there is 750 educational resources that are provided by the University of British Columbia. Welcome for your faculty, for your students to take advantage of these resources. They're fantastic pieces of content, and we'll highlight those towards the end of our session today. Now, the next 3 slides are extremely important. It's important to understand that CyberPatient was designed as a stepwise learning progression platform. It is designed to take your students through A to Z of their medical education. So looking at the platform, every case that we have can be broken down by specific levels. Level 1, novice, pre-clerkship, your preclinical. It, in the simplest terms, it is mastering the history taking. So develop a logical approach to patient-presented problems while actively using didactic reasoning to analyze the information received from the patient and improve history taking skills. Level 2, novice pre-clerkship, preclinical. This now supports the physical examination. So develop an understanding of a general physical examination and special physical examination tests. Students practice logical approaches to connecting information received from patients' history taking with a physical examination and determining a list of hypotheses or coming up with their provisional diagnosis. Level 3 is intermediate clerkship. Now, this will take the students through the full continuum of patient care intended for clinical. After 3 consecutive mistakes, it will push the student to the next stage of care. Level 4, intended for internship and advanced clerkship on clinical. And after 3 consecutive mistakes, it will actually restart the case. So really intended as a support for internship or residency training program. Now, just to give you an idea in a visual context of what this looks like on the platform, as I mentioned, level 1 is only history taking, level 2, physical examination, and level 3 and level 4 cover the complete continuum of care. Now, we also give the students some awareness of time and cost, and it's important in medical education for students to recognize that every examination, every treatment does have a cost associated to it. So as we see students' clinical skills and competencies develop, you would actually see a decrease in the time and the cost of the treatment. Now, these are just these figures are just as notables for the student, just so that they are aware and they're cautious in the treatment that they're providing to those virtual patients. Now, to give you another visual as to how CyberPatient and where CyberPatient fits in to the program, we can see that CyberPatient can support problem-based, case-based learning, so supporting textbook. It can be support as a preparation into simulation training facilities, standardized patient programs. Level 1 and level 2 support the clinical introduction to a clinical environment. Level 3 supporting clerkship, and level 4 supporting internship. And it's all based on competency-based education and assessment. So of course, with simulation, you do expect that assessment tools are provided inside of the platform. So we have built out our platform that has not only an intelligent tutoring system, so it will give case feedback to all of the students, but it provides a lot of academic flexibility for the institution and for the faculty to provide formative assessment. They're able to provide detailed documentation. You're able to evaluate the student reasoning. You can communicate to the students. It's also very transparent in the system based on their communications, the assessments, and the scoring. And then at the end, when you complete a course or even an examination, you have the summative assessment. And this can also be good and used with your administrators of the institution. They're customized summative assessments. There's a default assessment built in, but if you want to customize it, you can. We're also more than happy to support the integration with your LMS. Excuse me. Platform highlights. So approximately 80 outpatient cases, 45 odd inpatient cases, systems covered. We cover a number of different systems. We'll cover that inside of the platform in a moment, but we do have a number of proprietary animated assets, which are used for physical examination, procedures, surgeries, and others, proprietary art and design assets. So this is medical content with design, excuse me, and additional illustrations, and then diagnostic assets, about 2,000, which cover MRI, CT scan, X-ray, ultrasound lab tests, etc. And the medications on the platform is now about 5,000, and we've actually adopted the ATC classification. So we do have trade names, but we do have generics as well as the list from the ATC classification, making it easy for your students and institution. Now, one of the things I really want to highlight about CyberPatient is that we want to work with you to create and expand the platform together. So of course, we have 130 cases right now. We're growing those regularly, but we see a major growth of the a major growth of the platform by working with institutions like yourselves, in the case that we will work with you to identify if there are any gaps, any specific needs of special cases to address local or regional pathologies or diseases, and we will work to build up a case. It will go through a peer review process together, and then we'll test it in publishing. And your team is also welcome to take those cases and present them just like you would a published paper or a report. I'm going to, following the session, I will share out the research papers, but there are 3 that are especially of interest. So CyberPatient, an innovative approach to medical education. So this is from the University of British Columbia. CyberPatient is as effective as using standardized patients in the delivery of practical knowledge for novice medical students. However, CyberPatient is more economically rewarding. Number 3, this is from Kochi University in Japan. CAI using CyberPatient is more effective than text-only learning for physical examinations. Weaker and average students perform better on OSCE exams. And number 5, I just want to highlight that CyberPatient is not only for medical students, it's for all healthcare learners. It can be used within nursing as well. And this is a recent paper from an undergrad nursing program. And the use of CyberPatient-based clinical simulation is a great way for nursing students to combine, relate, and ultimately apply their theoretical knowledge to nursing practice. So if you do have time, I would highly recommend that you review and take a look at all of these research papers with CyberPatient. So there's my contact details if you have any questions. And I think what we're going to do now is we are going to jump into CyberPatient. So I'm just going to reshare my screen here. All right. So what's going to happen is I'm going to take you into our administrator or our faculty dashboard on CyberPatient, and we're going to go through the cases and the assessment tools, and we're going to build out a class, and then we're going to have Nikki join us, and Nikki is going to walk us through one of the cases that she has been assigned, and from there we'll go back into the assessment, and then we'll talk about the learning resources towards the end here. So what's going to happen is we're going to come on to CyberPatient. We're going to click on create a new class. And basically the class name here will go CyberPatient Simulation Network Introduction. And we'll just call it a description, CyberPatient Introduction. And we're going to enter a course period. So the course period, if you're running an examination or if you're running a full semester, you can choose the dates accordingly. So I'm going to set this just for 1 week. You're going to choose your faculty member. You're going to choose the skill level of the class. Just as a reminder, level 1 is history taking, level 2, physical examination, level 3, level 4, the full continuum of care, and then a required passing percentage. On the right-hand side, you're going to have the summative assessment details here. So we have a default criteria, which is the student has completed their assignments, the student responds to the feedback and has worked to improve clinical skills, clinical reasoning, and critical thinking. The student reached the required level of performance, and the student has had a good overall attitude towards the online educational process. Now, if you're not happy with this default, you can go ahead, you just click on create new, and you can write your own, and then you can go ahead and you can apply specific percentages as such. Now for today's demo and introduction, we're just going to use the default. So I'm going to click on complete. And what we're going to do now is we're going to add students to the class. So for today, we're going to add Nikki, we'll add Lucy, and perhaps Dr. Shariar as well. And on the cases list, now we have, as I mentioned, we have 130 cases, both inpatient and outpatient, and we cover a multitude of systems. So there's 130 here. So CNS, cardiac, ENT, gastrointestinal, genitourinary, musculoskeletal, neoplasms, obstetrics, pediatrics, psychiatry, respirology, and surgery. Now in each section, you can click just see more, and that will expand the list. You'll be able to identify if it's a outpatient or an inpatient case. And for today's demonstration, what we're going to do is we're going to use a couple gastrointestinal cases. So we have this case. As a faculty member, you're going to see the name of the patient, you're going to see the diagnosis, and you will see the learning objectives on each case. The learning objectives are aligned with the MCC, Medical Council of Canada, and these are learning and licensing objectives that will be required for medical students to meet the Royal College of Physicians and Surgeons. And so it's important for you to, as you assign these cases, is to review those learning objectives to make sure that they will align with your curriculum, with your learning objectives. So I'm going to go ahead and I'm going to assign a gastro reflux case, uncomplicated diverticulitis, and we'll assign just one more here, Adrian Coleman. Okay, and I'm just going to click done. And now I can see that my class is created for Nikki. And so without further ado here, I'm going to sign out and I'm going to invite Nikki to join us.
Thank you, Mark. If I could please kindly ask Raj Kumar to allow me to share my screen. Uh, Today, I will be walking you through the student experience. Thank you. Okay.
Did that work for you, Nikki? Perfect.
Oh, I'm now sharing the wrong screen. Okay. 1 second here. Okay. Are you all able to see this?
We can, yes. Thank you.
Perfect. So by logging into the platform here, we are able to see the student dashboard. We see the list of classes that I'm enrolled in. We have the skill level that I'm currently set to, and a summary of my last case performance. By opening up our class, we see the settings that Professor Mark has just set. So the skill level for the class, the required passing score. We will have my course performance summary here, and it updates as I complete the cases. We have the cases assigned in the class listed here. And as I complete a case, my professor will be able to leave formative assessment, and this will be displayed here. So today we're going to be walking through Jeremy Ramsey. By clicking on the case, we see an overview of the patient profile. And if I need any refreshers before we begin, I can review a tutorial on each section of case taking. So let's start the case.
Hello, I'm Dr. Smith. I'm the on-call doctor today.
Hello, Dr. Smith.
And can we all hear that properly?
We sure can, yes.
Perfect, thank you. So before we begin, I'm actually a business student, as Mark mentioned earlier, so please do not worry. I will not be treating any real patients anytime soon. Once we go into patient history, every case will begin with this. I am able to translate the interface into 72 different languages here. I also have a patient chart. So as I go throughout the case, I'm going to document my findings and provide reasoning. There are some tips down here if you are a novice at chart taking, and there's a help button here. By clicking on the help button, I will be prompted to watch a tutorial on this section, and there are some FAQs that I can refer to. So our history taking is structured with medical school's classic method for history taking. We have categories here, such as patient information, chief complaint, history of present illness, and so forth. So if I were to open up patient information here, I can ask the first question.
What is your name and age?
My name is Jeremy Ramsey and I am 37 years old.
I can now go into chief complaint.
What seems to be the problem today?
I have heartburn and burning pain in my lower chest.
And these questions are sorted based on relevancy. So if I ask a question that is irrelevant to the case, we're going to see this as at the end, and I will not be scored any points for asking questions such as,
How is your financial situation?
Good.
navigating through these questions are directed towards more novice students, but as I progress, I can search directly based on keyword here. So I can look for...
Do you eat spicy food?
Yes, I love spicy food.
Or...
Does alcohol make the pain worse?
Yes, it does.
Now, we have around 150 to 200 questions available per case. For the interest of time, we will not go through them all today. But before I'd finish up my history taking, I'd want to fill in my patient chart. So for chief complaint, he has heartburn and burning pain in his lower chest. And then I will draw my list of hypotheses here. And now as I fill out this chart, this will be saved as I go through. And my professor will actually have access to this as well at the end. So let's finish patient history.
Thanks for the information. At this time, I would like to do physical examination. Please let me know if you feel uncomfortable. I will wash my hands before we start.
We are now into the physical examination section. At CyberPatient, we focus on experiential learning, so this is learning by doing. And we see this in this section as it's labor intensive and I actually have to perform these exams. So if I were with our physical examination, we have general exams and special exams. Our general exams have 3 components. We have vitals, methods of examination, and diagnostic instruments. So let's start here by taking Jeremy's pulse.
Please give me your wrist so that I may check your pulse.
And I can start and stop the clock here, and I'll count the pulse above here. Now if we go into the blood pressure,
Please put your arm in this cuff so I can check your blood pressure.
I'm going to pump the manometer, and I'm able to then release the pressure. From here, we can determine the systolic and diastolic pressures. I'm also able to zoom in to specific areas to further examine.
I'm going to take a closer look at your head.
So by zooming into his head, I'm prompted to use tools such as the speculum,
Please tilt your head up so I may use this speculum.
tongue depressor,
Please let me use this tongue depressor to examine your mouth. Please sit still so I can use an otoscope to examine your ears.
and lastly,
Please look into the light on the ophthalmoscope.
and if there were any pathological changes, this would be displayed here in the imagery. Now if we zoom into his chest,
I'm going to take a closer look at your torso.
we can perform the auscultation,
I will use my stethoscope to examine you.
and we have clues here for the more novice students. And I am just holding and listening here. Now if we rotate him around,
Please turn. Please turn.
I can continue to listen.
I will use my stethoscope to examine you.
And I can listen to the bronchial sounds here. So now if we go in and perform a percussion,
I will inspect you by performing further examination.
we can listen and notice the resonant and dullness sounds. Lastly, if we lie him down,
Please lay down.
we can listen to his stomach once more.
I will use my stethoscope to examine you.
And go in for a superficial palpation.
I will investigate using my hands. Please let me know if you feel uncomfortable.
And now in for a deep palpation.
I will investigate using a little more pressure. Please let me know if you feel any pain.
And once we've completed our general exams, we can now move on to special. For this section, we provide animation. So I'm able to navigate through the categories to find the exam I would like to perform. So let's do a palpation of the spleen.
I am going to palpate your abdomen for your spleen. Let me know if you feel any pain. Please take a deep breath. Please take a deep breath. Spleen is not palpable.
And if I'm more advanced, I can search directly for an exam. So if we go in and perform a Murphy sign,
I'm going to check your gallbladder. Please let me know if you feel any pain. Please take a deep breath in. Murphy test is negative.
and once we have completed our physical examination, I would then go and fill out my patient chart. But for the interest of time, we will not do that today. So I will hit submit.
After examining your patient, do you believe they require any immediate care?
And so this is when the decision making begins, and we continue on to level 3 and level 4 of the platform. So I'm going to hit no for today.
What is your provisional diagnosis?
And in the provisional diagnosis, I'm going to refer back to my original hypothesis, and I'm choosing 3 conditions. Now, if I make an error, I will be prompted with this message.
Incorrect. Please try again.
So I'm able to redeem myself.
Please select the lab test that you require.
We now go into investigations. So I'm able to navigate through categories once more. Let's perform a CBC. My results will immediately appear, and I can select a specific row for the value to appear. So if we go down to white blood cells, the value will pop up, or I can select all to get a full panel. We can search for tests directly. So I'm going to go in for an X-ray of the chest. Findings and impression are on the left, and to get a better scope of the image, I can click to expand. Let's go in for an ultrasound now. Report is on the left, and click to expand the image. Now, any exam or test that you can perform in a medical lab or hospital, you can perform here on the CyberPatient platform. So let's hit submit.
What is your final diagnosis?
For our final diagnosis, Jeremy has gastroreflux.
What would be your management plan for this patient?
And we now transition into the management and treatment plan. So this will be non-invasive.
That's correct. How would you like to proceed?
We will send him home with some at-home orders. So for activity, he can be active, activity as tolerated. For diet, it'll be non-MPO, and then diet as tolerated. We can choose some recommendations, so searching by keyword. So elevate the head of the bed, limit spicy food, and avoid large meals. We can now refer some specialists to further support. So as a dietitian also. And now on to medications. As Mark mentioned previously, we have around 5,000 medications available on the platform. I can search directly here by name. So Nexium, he can take it once a day for 28 days. We can leave some instructions. So take with 8 ounces of water. And we do have the North American trade names, but as mentioned previously, we also have WHO's ATC classification, which is seen here. Lastly, for follow-up, he can meet with his primary care provider in about 1 month.
You are ready to go home now. We wish you a speedy recovery.
So congratulations, we have just completed our first CyberPatient case here together. And you've just seen the full continuum of care. So this is end-to-end patient care. And at the end, our intelligent tutoring system has automatically calculated my score based on 3 indicators. We have knowledge, the time on the platform, and the cost of care. And these are broken up into each section as well. So if I open up history taking here, we see those indicators once again, and I'm able to view my specific feedback. So on the left are the choices that I made. The questions are sorted based on most relevant to least relevant. And as promised, how asking about the financial situation was irrelevant to the case. I scored quite low here as I only asked 3 relevant questions. But to further the learning opportunity, I'm able to look to the right and see the most relevant choices that I will know to ask next time. If we go into our diagnosis, on the provisional diagnosis, I scored 50%. This is because I made an incorrect decision by selecting colon cancer. But by the time of the final diagnosis, I scored 100%. Now, this detailed level of documentation is important because textbooks don't provide this opportunity, and in hospitals, the resources are limited to provide this type and detailed level. Now, we're able to open up the patient chart here. My findings and reasoning have been recorded, and I can export this or save it as a PDF. Now, before I pass it back over to Mark, I'm going to show you our educational resources section. So this is a customized information resource with web-based modules, interactive web objects, and this is all provided by the University of British Columbia. We have around 750 resources here. So I'm going to open up one of these as an example. And all professors and students and users of the CyberPatient platform have access to this. So we see a lot of information and text that I can refer to. And I'm going to just scroll down here and show you one of our animations.
Crackles can be heard during inspiration or expiration. Fine crackles can be caused by collapsed alveoli popping open during inspiration and may clear with deep breathing.
Okay, so thank you so much. This has been the student experience. I'm still here. This has been the student experience. I will now pass it back over to Mark, who will show you the professor dashboard once again.
Thank you, Nikki. I appreciate that. So I'm just going to jump back into the CyberPatient platform here. I will just cover a few things. So as a faculty member or admin, I'll be able to open up our active class, which we had created. And what you'd see here is on the left-hand side, you'll see a chart showing your student statistics. So as you have numerous students working on cases, it'll show them you'll be able to choose the case, and then you'll be able to see the average, and you'll be able to see how they've progressed through multiple attempts on the case. So CyberPatient is all about learning by doing, and of course by working on cases multiple times. That is going to build help develop the skills and competencies of the students. On the right hand side, you're going to see your students. You're going to see a red indicator with a number inside of that, and that's going to determine the score that the student has received. And so basically what I can do now is I'll be able to see a performance snapshot, and as Nikki completes additional cases, she works on the case multiple times. Again, we're going to see how her performance changes and how she develops. We'll be able to click on the feedback button and click on see details. And here we're going to be able to see the same feedback chart that Nikki had seen. So going into the history taking, we'll be able to identify that Nikki's only asked 3 relevant questions, a less relevant and a relevant question. We'll be able to review her patient chart. And if she's put together some rationale on her findings, we can export that chart if we need. Review all the patient management, the treatment. One thing I want to show you here on the treatment is that we do have, of course, gold standards, in this case, Nexium, but you do have alternative medications that can be included inside of the platform. So there is a lot of flexibility for the academic freedom and for you as an institution to make sure that the platform accommodates and supports what your standard will be in your institution. Now, going back, after reviewing the feedback, I'm going to put a note in, good morning, Nikki, great job on your first attempt. I noticed you struggled within your history taking. Please review CyberPatient Learning Resources lecture on history taking, and review chapter 1 of a Bates guide, and so you can make some suggestions and support the student with that feedback. You save it, it's gonna push that information to Nikki, and next time you come back onto the platform, you're gonna be able to see that Nikki has made multiple attempts on the platform on the case, so easily to identify how she's responded. Now, going back into my dashboard, what we would like to do is we would like to offer a summative assessment. Now, because Nikki this class is not completed, we're going to open up a class that we had already completed, and you can see here that we have our assessment on this platform here. The default Nikki on this class, she scored 52%, but she completed her assignments. She's responded to the feedback. Unfortunately, she did not reach the required level of performance, but she had a great attitude towards the online educational process. So we've decided to pass Nikki. We would, we would submit it, pass, and then what we can go back is we can just go back, and then the system would generate a certificate. Now, this is just a placeholder, but the certificate will be branded by your institution, and this can actually be sent into your dean's office, your administrator's office, and to the student. Now, just to wrap things up, under these educational resources, I do want to highlight a couple things here. If you click on B, about CyberPatient, there's a number of webinars by Dr. Kayumi here. Also on our educational resources, we do have our expert series available. And every quarter or so now, we've started to host an expert series with different medical professionals. So there's Approach to Imaging by Dr. Savas Nicolo at Vancouver General Hospital. We've got Surgical and Medical Ethics by Dr. Alberto Ferreras. And then we also have Learning in Healthcare by Dr. Kayumi. So I'd welcome you to take advantage of all of these resources that are available to you. Now, if you would like to join the platform and just to have a quick look inside of the platform, I would like to invite you to register for a free account. Just so if you just want to go in and work through a few cases, get a better understanding and look and feel of what it looks like from a student perspective. So you can go, Mark at, and you can just click, write your name, and you can select your occupation as an educator, put your country, your institution name. And once you do that, you will have access to 13 free cases that you can work through. We would also like to invite you and your students to join the CyberPatient Summer School of 22. And this is just an initiative that we are doing right now so that faculty for students as an additional learning opportunity, they can join a virtual rotation of their choice. And they're going to be invited to 3 classes. So our registration is now open, and we expect that these classes will begin towards the end of July. There'll be 3 classes. First class will be history taking and patient chart. There'll be 3 cases will be assigned, and they'll have 3 weeks. And then class 2 will include the physical examination, and class 3 will cover the full continuum of care. So if you're interested, please go ahead to CyberPatient and you can register for a free account, and you're welcome to register and join our summer school of 22. So I would like to cordially thank you all for your time today. We really appreciate the opportunity to share CyberPatient with you. And if you have any questions, we'd be welcome to take those. And of course, if we can support you or your institution in any way, please do reach out. We do have a what we call a CyberPatient subsidy program. We do recognize that there is a lot of financial difficulties within medical institutions at this current moment, given inflation and all the other issues that are taking place. So if there are areas where your institution also needs support, we do have partners in place to make sure that quality medical education is attainable and affordable for all, which is an important mandate at CyberPatient. So again, thank you so much for your time, and really appreciate the opportunity to engage and looking forward to learning from each other. Thank you.
Yeah. Hi, Mark.
Thank you, Dr. Rajkumar.
Yeah, am I audible?
Yes.
I'm sorry. Yeah. So I got a few questions on my WhatsApp though. I'll just ask them to you. So in the beginning of your lecture, you mentioned about elective 1, elective 2, internship year. Now, can the same curriculum be customized to an Indian context is what the question is? Because in Indian context, we don't have electives. We have semesters, semester 1, semester 2, semester 3, and then an internship.
Yeah, absolutely, absolutely. So the platform is designed that your institution has the flexibility to adapt the learning objectives for whichever your course is designed. So each case is broken down into 4 areas. So as I mentioned, history taking, physical exam, and then the full continuum of care. So it's not so much on following a specific term. It's just where CyberPatient can support. And again, we'd be happy to support you on that. So if there are specific questions or you need additional guidance, we do have Dr. Shariar here, and we also have Dr. Kayumi. We'd be more than happy to support and have a deeper look with you at your curriculum and to better support exactly how you might want to implement. But the platform is intended so that you have a lot of academic freedom and you can work the platform in as large as you want or as little as you want into your program.
Right. Perfect. So thank you so much, Mark, for making this happen. And we hope we can catch Dr. Karyumi in the next talk, so we can have him talk about competency-based medical education. And thank you, Nikki and Dr. Sharia, for walking us through the platform as well. It was as impressive as I saw it, the way I saw it the last time you guys did it for me. So we hope this leads to an entry of CyberPatient into the Indian scenario, and the people start using it at their institutions. Thank you very much.
Absolutely, really grateful for your time and support, and looking forward to supporting yourself and your colleagues in the very near future. Thank you again.
Thank you, Mark. And I hope in the next webinar we can officially make an announcement about using your platform at our institute. So thank you.
Beautiful. Thank you.
Thank you so much.
Have a wonderful evening.
Thank you all.
Thank you very much.
Thank you so much. Bye-bye.
Thank you.